Thank you so much for the opportunity to present. I'm going to talk about assistive technology, specifically about wheelchairs and access to those tools for children with disabilities in Ethiopia. So, as you mentioned, my work is all about children with disabilities, more specifically on assistive technology. So, I would like to start by introducing what is assistive technology, what are the benefits of it. I'll talk more about the wheelchairs. So wheelchair is one of the most commonly used assistive devices. So it opens up opportunity for people with disabilities to study, engage in social activities and access services. It's one of the most important tools and appropriate wheelchair. So I will talk about what is an appropriate wheelchair and what is appropriate assistive technology, benefits physical health, quality of life, and also it helps by reducing common problems such as pressure sore, progression of deformities, and through respiration and also digestion. So overall it helps to improve quality of life of people with disabilities. But to ensure effective mobility, wheelchair users need a wheelchair that fits them correctly, so and meets their specific needs, because every wheelchair user have different needs and also should be fitted to them like correctly. So it's not one size fits all. That's how when we some people think that, for example, as technology or wheelchair is like one size fits all, but especially in low resource settings, but that's not the case. It should fit them correctly and meet their specific needs. For example, if they also their environment, so it depends on where they live. So if they live in terrain area, or if they live in urban areas, so their environment also determines what type of device they use. So, but it's estimated by 1% of total population, that's like 10% of people with disabilities need a wheelchair. So about 75 million people worldwide need a wheelchair, but only 5 to 10% of those requiring a wheelchair for me, they have one, especially in low and this is statistics from low and middle income countries. So only 10% of them have access to assistive technology, and only very few have access to appropriate wheelchair. So what is the use of appropriate, for example, for pediatrics? So for pediatrics, it's really important that they have early mobility for children with disabilities, because locomotion and other mobility skills develop quickly during the first 3 years of life. And these skills are the main avenue for learning, socialization, and growth of the sense of independence. So children learn by exploring. So exploring is learning. So their cognitive, social, all of their development is because of exploring. So if they don't have access to explore their environment, if they can't explore their environment by their own, usually just by an assist, by device, by using device, they do not have learning. So they're all physical, social, cognitive, all of the development is hindered. So toddlers and children who cannot walk, crawl, or cruise to get around their environment, they miss out on sensory motor development activities that their peers who can move had achieved. So they compared children who have early mobility and those who do not have early mobility, and they found out that these children develop learned helplessness. Though they will give up on their environment, they become less curious, their cognitive, social, all of their development is delayed, or compared to their peers who have those opportunities to explore their environment, their development is very less or reduced. So there is a document by Ethiopia. It's one of the largest organizations that's working on advancing access to assistive technology, and they put out this document about the case in investing in 80. And they found out that if you invest $1 in assistive technology, you get $9 back. That's because of achievement in health benefits. So they will have access to appropriate services because they have mobility, and also they have a lot of preventable complications. There is also economic benefit. They go to education, employment, productivity, and also there is reduce caregiving burden on families, and to take on paid work. And also there is a societal effect overall. So there is a lot of benefit for investing in assistive technology, but when you come to low and middle income countries, the investment for assistive technology is very insignificant, almost non-existent in many, many places. But as you can see, the benefits is huge. And it's worthwhile for a society to invest in assistive technology for people with disabilities. So what is the current provision, assistive technology provision in Ethiopia? So this diagram depicts or shows the current assistive technology provision in Ethiopia and in many other places. This is a very common occurrence. So usually there is very limited capacity for local production and also quality control. So they are usually the devices are donated. So most inappropriate devices. There are also some of them are produced locally, but most of them are imported. So they do not meet rural standards or African standards. It's a different organization. So, but yeah, so the most of the devices that are donated are not appropriate to the local environment. So they're not appropriate to the end user. So they are given to wheelchair users without any prescription by trained professionals. So these also are abandoned. There is a high rate of abandonment, and also they create complications. For example, they create postural deformities, pressure sores, and also there is very, very limited follow-up services. For example, if they are broken, repair follow-up services are not available. So, and also they are discarded. So they create environmental issues. Landfill is created, so all sold to the next user, and the negative impact is not usually not reported. And through the University of Gondar, we have done a study on rate of abandonment of assistive technology, specifically for wheelchairs, and we found out there is a high rate of abandonment, more than, I think, close to 40% of abandonment within few months of those users receiving these inappropriate devices. So there is imported devices donated without assessment, prescription. There is a WHO guideline for proper assistive technology provision, but this is not followed in many places. And available devices are low quality and inappropriate for the environment. They are not designed to work in a rough terrain, for example, in African terrain and environment. So they are leads to secondary health complication, pain, cost of family and health system, and private purchase is not affordable. So and also there is health insurance, but health insurance doesn't cover assistive technology, I think, because they think that it's a luxury or more or expensive. So there are a lot of reasons why it's not being given a priority, but private purchase is not unaffordable for most families. So, for example, this is a recent picture that I found on social media. The politicians giving out wheelchairs or inappropriate wheelchairs, children being placed in adult wheelchairs. So this is some of the complications that are result of inappropriate wheelchair provision. So overall, there is a lot of issues. So when I started working, I've observed all of these issues. So there is very limited access, shortage of therapists in proper assistive technology provision. Services are remain donor dependent and fragmented, not integrated into the health system. There is a lot of quality issues because there is no investment in procurement by, for example, by government or health systems. There is hardly any incentive for private or manufacturers to engage in this work. So there is also quality issues. So there are also misconceptions about the role of devices. For example, children are being advised to use a device after they not early, because they think that it will hinder them from achieving other milestones, such as walking, but that's not the case. So if they miss out early mobility, as I told you, they develop a lot of complications and their development will be hindered. So there is this issue. So I set up a local non-profit social enterprise called Grand Assistive Technology to work on these issues. So to advocate for access to appropriate assistive technology. So the reason why I started it was I see children carried by parents, left out of school, play, and due to lack of appropriate assistive technology. So I meet children in my community that never went out of their house because of lack of assistive technology, and their families are burdened. So they always require devices, but they do not get, or once they get poor quality of devices. It broke down. There is no follow-up service, repair, and also they are placed in inappropriate devices. So I've seen this all. So I want to advocate and also work to contribute to this cause. So we set up a social enterprise. So we have it. So we plan to do all these activities. So to assemble and manufacture 18 products appropriate to Ethiopian context, to provide disability awareness training, train and develop 80 curriculums on train therapists on appropriate wheelchair service provision, the WHO guidelines, and also research and publish reports, and also provide a range of programs for parents and caregivers. So assistive technology will not solve all those problems of participation. So the goal for rehabilitation is participation. So to enable participation of children with disabilities, to for them to be able to participate in their community and also be involved in life situations. But provision of assistive technology will not only that will not solve all the problems, but you need also associated other services. For example, you need to raise awareness about stigma, you need to provide rehabilitation services and other services. So associated services, not only assistive technology, because also that's a huge gap in my community on rehabilitation services, both assistive and rehabilitation services. So our organization have a hybrid structure. So we have GAT, this is a non-profit organization. So we the mission is to build disability inclusive for inclusion for children with disabilities, and we have a lot of training and a lot of activities on rehabilitation and assistive technology, but also we have a social enterprise or a business that works on generating income to the non-profit, but also working on those assistive technology projects. So we have this diagram that shows the organization structure. So within my organization, we just started, so it's been like only, I think, 2 years now. So we have been working on the foundation, a lot of foundation stuff, but we have different programs now. We have intensive therapy program, one of the rehabilitation services. We have daycare for children with disabilities. We have skills training for parents. We have assistive technology services, where I'll talk more about it, and also professional training in capacity building. So let me talk about the rehabilitation services, and I will come into the AT part. So the first one is intensive therapy program for children especially with developmental disabilities and cerebral palsy. So this is a 15-day residential intensive therapy program for children with cerebral palsy and developmental disabilities. So the focus is for parents from rural areas who have limited access to rehabilitation services. So children, why we started this program is children with disabilities that live in rural area face a major barrier to accessing therapy, because rehabilitation services are only available in urban areas. For example, in my community, Skonder, the biggest city in my area. So we have a physiotherapy, occupational therapy at the hospital, but most parents that live in rural areas, they cannot access these services. They have to travel to city, they have to stay in the city, and also rehabilitation takes a long time. So for them to learn about skills, how to help their children. So we remove this barrier. So there is a residential model. It's a residential model. We offer therapy and accommodation and meals on the site. So they will spend in our center for 15 days. And then when they come, they have children will have like 15 parents in one round come to our center. And then we have the children will receive therapy, all those services, so what they need, and also parents receive hands-on session on how to help their children at home, and then will also provide home programs tailored to their living conditions. So we'll teach parents what to do at home, and also we'll give them a lot of education. So they meet with other parents, they have peer-to-peer education group sessions, and also we teach them about, we have sessions on psychological support, advocacy, and all those topics that are relevant to them. And then after 15 days, they will go back to their community. So we have completed 8 rounds, so more than 110 parents and children from 14 remote areas. And also this is one of the parents, a lot of parents like this program. So this is some pictures from our intensive therapy program. And we have a daycare program. So we have a daycare for children with disabilities. This is the first daycare for children with disabilities in my city. So because first when we meet these parents, so they were burdened by caregiving. So a lot of parents are so they spend a lot of time caring for their children at home. So most of them are poor single mothers, because due to the stigma, most of the time fathers leave them. So they are single mothers. They spend a lot of time caring for their children. So they do not have opportunity also to work, to earn a living. So we remove this caregiving burden. So up to 30 children come to our center every day. We give them therapy and all. So about the assistive technology, we set up an assistive technology workshop. So with all the equipment that we need, including a 3D printing. And so we have about the progress about assistive technology. So we have identified a model. So because some places, for example, in Africa, they have done a very good job in improving access to assistive technology. For example, in South Africa, they have a very good system. There are very good, high quality, as I mentioned. So we have identified a good collaboration organization. So it's a south-to-south collaboration, because even in many places, so they have a very good model. For example, in South Africa, as I mentioned, there is a very good model for assistive technology provision in low and middle income settings. So we have forged a partnership with an organization called Shona Cube. It's one of the leading assistive technology providers and also social enterprises in Africa. So we have been working with them to replicate their model and also work on our own expanding and also establishing a very good quality assistive technology manufacturing facility. So we have a very good partnership with Shona Cube, and currently we set up our own workshop and started working on design. So we are currently designing a power wheelchair for children with disabilities in collaboration with Shona Cube. And also we started training therapists on appropriate assistive technologies, so how to feed, how to prescribe, and how to do follow-up services. So we have trained therapists locally. And also we are experimenting on some devices. For example, we started making standing frames, aerial tools, 3D printing, which is a very good new technology now that can be used for assistive technology. We are experimenting with that. And also we are doing a lot of advocacy with government, with local stakeholders about the importance of appropriate assistive technology and how to improve access to these devices for children with disabilities in Ethiopia. So these are some of the devices that we are making. But there are a lot of challenges. So the first one is there is very limited capacity for AT production. So you need professionals. We need a lot of human resource and funding constraints. For example, as I mentioned, there is very limited funding for AT because that's not being recognized as essential for children with disabilities. So there is a huge awareness gap. And also there is quality control, proper policy that that supports access to assistive technology. So all of that issues, there are a lot of issues that are the challenges. But the opportunities are, there is growing awareness. So we have done a lot of awareness creation, and there is globally an increased awareness about appropriate assistive technology. And also there is a potential and also the collaboration with other African organizations and advocacy groups. That's also a very good potential. And there is strong partnership. So, but this is my presentation about assistive technology, the current challenges, and what we are trying to do about it. So, thanks so much.